Hello, and welcome to Navigating Recovery with Support Systems, Project COPE, Connect for Overdose Prevention and Education. My name is Barbara Shafer. I'm a certified recovery peer specialist and facilitator of Project COPE and GRASP for the Hanley Foundation. To give you a bit of context, you may be asking, what exactly is a certified recovery peer specialist? A certified recovery peer specialist credential is for those who use their lived experience and skills learned in training to help others achieve and maintain recovery and wellness from mental health and/or substance use conditions. Lived experience is a foundation of peer-to-peer support services. As such, certified recovery peer specialists fit into one of the following endorsements: adult, family, veteran, or youth. My endorsement is with family. I have lived experience as a family member to another person who is living with a mental health and/or substance use condition. 7 years ago, on January 28th, I lost my daughter Allison to complications from intravenous drug use, and at that time found it incredibly difficult to find support. It is then that I made it my mission to help families affected by substance use and/or who have lost a child to addiction, bringing hope to those families and individuals struggling with substance use disorders, and to change the conversation and reduce the stigma. The objectives for today's webinar are as follows: to discuss and explain substance use disorder as a brain disease that it is, to reduce stigma by changing the conversation and language, defining principles of care and the new dynamic in family relationships, principles of harm reduction, family and grief support groups available, as well as other resources. The American Medical Association definition of addiction. Addiction is a brain disease. Addiction is a complex condition, a brain disease that is manifested by compulsive substance use despite harmful consequences. People with addiction, severe substance use disorder, have an intense focus on using a certain substance, such as alcohol or drugs, to the point that it takes over their life. Science has proven that substance use disorder is a chronic brain disease that can be managed with medical treatment. It is not a moral failing or a character flaw, but still only 1 in 10 Americans with a substance use disorder receive treatment. Addiction is highly stigmatized, and that stigma is what's fueling an American public health crisis. As you can see here, about 45% of us think that all that's required to overcome addiction is willpower. Less than 20% of Americans are willing to associate closely with someone who's addicted to prescription drugs as a friend, colleague, or neighbor. And 33% think addiction is caused by a character defect or bad parenting. So willpower, isolation, and/or bad parenting are not causes of substance use disorder. These are the thoughts that cause the stigmatization of substance use disorder, and why many will not talk about a family member that is suffering from this condition or seek support. So the healing power of even the most microscopic exchange with someone who knows in a flash precisely what you're talking about because she experienced that thing too, cannot be overestimated. Connection to services and other peers that have experienced the same situation is key to helping those with substance use disorder and their families get support. It took me about a year after my daughter had passed that I decided to speak out about my experiences so that others would understand that this is a non-discriminatory condition that affects all types of people from all walks of life. I realized that nothing was going to change if we didn't start speaking about this epidemic and advocate for ourselves and our families. So what is stigma? Stigma generates multiple barriers for people with an opioid use disorder to seek treatment, recovery from treatment, and stay in recovery. Its totality means people with an OUD can progress on their own pathways for recovery and still be faced with a gauntlet of discrimination and continued barriers to recovery. This particular slide is from Shatterproof website, and it describes the 3 different areas that stigma can affect you: public stigma, structural stigma, and self-stigma. Public stigma would be society's negative attitudes toward a group of people, creating an environment where individuals feel unwelcomed, judged, and/or blamed. For example, less than 20% of Americans are willing to associate as a friend, colleague, or neighbor someone with an opioid addiction. Structural stigma. Systems-level discrimination caused by institutional policies and/or dominant cultural norms. 25% of emergency medical or family internal medicine professionals feel that treating OUD will attract undesirable patients to their practice. And finally, self-stigma, where individuals accept societal stereotypes and experience reduced self-esteem and self-efficacy. For example, John, a young adult with OUD, enters an evidence-based treatment. However, he has internalized negative messaging from society, making him feel unworthy of recovery and isolated from his friends and family. Stigma will affect the family the same way that it affects the individual with a substance use disorder. Families tend to think it is their fault and can be ashamed to seek support. So how stigma can impact recovery? Stigma can reduce willingness to seek professional help. It can cause reluctance to attend treatment, can limit access to healthcare, housing, and employment, can diminish self-esteem, and exacerbate depression, as well as affect personal relationships at a time they're most needed. Language truly matters when it comes to stigma. One way that we can help break the stigma is to stop using negative language. As you can see here, there are alternatives to how society has described substance use disorder in the past and with many people currently. We need to use the person first language when speaking about individuals. For example, on the left side, you see the stigmatized language, where they would use the term addict, and now we can use the term person with a substance use disorder. Addicted to X, person with a substance use disorder. Addiction, substance use disorder. Alcoholic, a person with an alcohol use disorder. You're clean, you're abstinent. A clean screen would be substance-free. Dirty, actively using. A dirty screen, testing positive for substance use. A drug habit, a person who uses drugs. Reformed addict or alcoholic, a person in recovery. Opioid replacement, medication-assisted treatment. Recreational or casual user, a person who uses drugs for non-medical reasons. Experimental user, a person who is new to drug use. You can see by using the terms on the right side instead of the left side, it will help eliminate the negative connotation from stigmatized language. So Shatterproof has put together national principles of care for addiction treatment. There are science-based practices which improve outcomes for individuals with a substance use disorder and their families. Number 1, routine screenings in every medical setting. Screenings for substance use disorder should be part of routine primary care visits, similar to screening for chronic disease such as diabetes. Screenings are proven to help prevent, treat, and sustain recovery from substance use disorders. Also, it's critical that discussions about substance use and misuse in medical and behavioral health settings become part of a normal routine. Number 2, to have a personal plan for every patient. No single treatment approach works for everybody. Personalized care is used to treat other chronic illnesses and has been shown to help people with addiction stay engaged. follow their plan, and have better health results. One treatment does not fit all. Number 3, fast access to treatment. You should be able to get treatment as soon as you are ready. Number 4, long-term disease management. Long-term disease management is addiction treatment should include long-term management and follow-up, not just a one-time treatment. This type of cascade of care includes prevention, identification, treatment, and recovery. Number 5, coordinated care for every illness. Coordinated care for every illness, addiction treatment should consider the whole person. Number 6, behavioral health care for legitimate providers. Certain behavioral health therapies, such as cognitive behavioral therapy and family behavioral therapy, are proven to help manage and treat addiction effectively. Number 7, medications for addiction treatment. Treatment facilities should help you understand all of your treatment options, including FDA-approved medications, and help you get the right medications if needed. Number 8, recovery support services beyond medical care. Support for recovery outside the doctor's office. Treatment is more successful when other circumstances are addressed, such as housing, employment, and personal relationships. So there is a new dynamic in family relationships. It used to be thought that it was right to kick out the individual with a substance use disorder or let them hit rock bottom. And unfortunately, with the availability of fentanyl nowadays, rock bottom can be death. So what we need to do now, here are from the Parents of Addicted Loved Ones website, 6 steps for families to take. Learn about delayed emotional growth. Substances can and will affect emotional growth. Transition to an adult-to-adult relationship. Set realistic boundaries and consequences. Spell out if this happens, when this happens, what will happen. No surprises. Cut strings to encourage responsibilities. This can be different for everyone, but very important for self-esteem. Write your own plan and try to stick to it, and encourage your adult child to write their own plan as well. Most of these steps are used in the CRAFT program, Community Reinforcement and Family Training, based on a book by Robert Meyer, and I'll discuss this a little bit more later on in the presentation. Self-care is very important when dealing in the situation of substance abuse. You can see by this wellness wheel, there are 8 areas to consider when determining self-care and wellness. And this wheel is good for those with a substance use disorder, those in recovery, and for families as well. So we have, at the top of the slide, you can see emotional, coping effectively with life and creating satisfying relationships. Financial, satisfaction with current and future financial situations. Social, developing a sense of connection, belonging, and a well-developed support system, extremely important. Spiritual, expanding our sense of purpose and meaning in life. Occupational, personal satisfaction and enrichment derived from one's work. Physical, recognizing the need for physical activity, diet, sleep, and nutrition. Intellectual, recognizing creative abilities to finding ways to expand knowledge and skills. And environmental, good health by occupying pleasant, stimulating environments that support well-being. So as you can see, there are many, many pathways to recovery for all of us, for families as well as individuals. And these are just a few different pathways. 12-step programs, AA, NA, Nar-Anon, medically assisted therapy, MAT programs, SMART recovery, self-management, and recovery training. Celebrate Recovery is another program that's available in the communities. Recovery community centers like the Hub in Delray. Harm reduction, and these are just a few that are available in the community. You could also include individual therapy on that list. So next we can see, here's a slide about harm reduction. Some people aren't familiar with it. And what is it? Harm reduction strategies seek to reduce morbidity and mortality associated with substance misuse for those whom abstinence is not an immediate or possible feasible goal. The goal of harm reduction models is to reduce at-risk, moderate, and high-risk behaviors often associated with substance use disorders. Why do we need it, you ask? Respond to disproportionate disease and fatality rates, to be able to reach vulnerable populations, and to keep individuals engaged if they relapse or are not abstinent from drugs and sex. Harm reduction services save lives by being available and accessible in a manner that emphasizes the need for humility and compassion toward people who use drugs. Harm reduction plays a significant role in preventing drug-related deaths. Go back one. Drug-related deaths and offering access to healthcare, social services, and treatment. These services decrease overdose fatalities, acute life-threatening infections related to unsterile drug injection, and chronic diseases such as HIV and HCV. There are many mutual aid support groups that are available in communities. They're also called self-help groups, and they're a very important part of recovery from substance use disorders and for families as well. Mutual support groups exist both for persons with an SUD and for their families, and significant others are one of the choice individuals has during the recovery process. You can see here again, AA or NA, Al-Anon, GRASP, which is grief recovery after a substance passing, CRAFT, community reinforcement and family training, group therapy, smart recovery, medication-assisted therapy, individual therapy, Project COPE, and the list goes on. These are some additional family support resources and websites associated with them as well. Project COPE, which is what I facilitate, is Connect for Overdose Prevention and Education. It's a support group, and it meets on the first and third Thursday of each month virtually. And there's a link on the Hanley Foundation website. CRAFT, this is what I mentioned earlier. CRAFT is Community Reinforcement and Family Training. It's based on a book by Dr. Robert Myers and Brenda Wolf, Get Your Loved Ones Sober, Alternatives to Nagging, Pleading, and Threatening. You can get information, you can get the book and go through it. You can also get more information on the CRAFT program through Allies in Recovery, and their website is alliesinrecovery.net. FA, Families Anonymous, a 12-step fellowship for the family and friends of those individuals with substance use and behavioral issues, and that's familiesanonymous.org. Nar-Anon, family groups, those are also 12-step programs for those affected by someone else's addiction, naranon.org. And PAL, which is Parents of Addicted Loved Ones, they have virtual groups available as well. Some additional resources, shatterproof.org, which I have pulled some information for this presentation, Partnership to End Addiction, which is at drugfree.org, Center for Family Services of Palm Beach County. They provide outpatient programs for individuals and families affected by substance use disorder. Family Recovery Solutions of Florida offers confidential counseling session for families and individuals struggling with active addiction. And there's also a parent toolkit by Discovery Education. It's Parent Toolkit Operation Prevention by Discovery Education. And that gives you a variety of different tools you can use to discuss substance use disorder with your family and with your children. I do want to say recovery is possible, and there are many resources available for families and individuals with a substance use disorder, and I've only highlighted a few. There are a variety of them that are in person, and there are also a multitude of virtual support groups and services available, and Facebook pages as well. Unfortunately, with over 100,000 overdose deaths that occurred this past year, grief is also an effect of this epidemic. So here are some do's and don'ts. If this is if you know of somebody, or if it's a situation, if you've lost a loved one, it's a practical guide to coping with grief. People who experience grief may often demonstrate changes in behavior. These suggestions will help reduce the probability of long-term reactions. For example, try to make sure you get enough rest, maintain regular diet, take one thing at a time, follow a familiar routine, talk to supportive people, maintain an exercise regimen, spend time with family and friends, expect the experience to upset you, and contact your EAP if your reactions persist. Some things not to do when dealing with grief. Don't stay away from work. Don't withdraw from others. Don't look for easy answers. Don't increase caffeine or alcohol. Don't reduce leisure activities or make major life changes. Take on new major projects, and don't have unrealistic expectations. Some of the other grief groups that are available, and here are some websites as well, and logos. We've got Team Sharing, which is at teamsharinginc.org. Grief Share, which is usually available through churches. It's got a very strong church connection to it. Griefshare.org. Compassionate Friends, which is an organization for parents that have lost a child for any reason. And GRASP, which is grasphelp.org, which is grief recovery after a substance passing. Some of the resources that I've used to put this presentation together, the HanleyFoundation.org, PBCHub.org, which is Palm Beach County Hub, the Palm Beach County Behavioral Health Coalition, NAMI, Shatterproof, SAMHSA, 211, and Faces and Voices of Recovery. This is my motivation for continuing this work. It's my daughter, Allison. In our minds, a constant thought, and in our hearts, a silent sorrow. I want to thank you all for your time, and hopefully some of these resources will help you with the support for families and individuals that have a substance use disorder. Thank you.